Hello, ladies and gentlemen. Welcome to Best Life Health Show with Dr. Best Life. Today, we are going to look at a very important topic, which is malaria. You will agree with me that malaria is one of the public health issues we have in sub-Saharan Africa and other parts of the world, but mainly in Africa and Nigeria in particular. So we are going to look at this particular topic, look at all the misconceptions surrounding this particular disease we call malaria. We have a very special guest by name Dr. Omoren Edward Aban, who is a public health expert. So Dr. Moran is here to do justice to this particular topic. So Dr. Moran, you're welcome to the show.
Thank you very much, Dr.
Okay.
Bestlife.
Okay. Like we normally do, we are here to look at the misconceptions that affects our health and then deal with them. We are here to bring out all the facts that so that our listening audience can take the facts and then drop the myth in order to help them to make a better health decision. So without wasting much of our time, we would like to know about this particular condition called malaria. I know sometime in April 25th, we celebrated World Malaria Day. So I would like to ask, what is malaria?
All right, thank you, Dr. Bestlife and crew. Malaria is actually a parasitic infection that is actually caused by a family of parasites called Plasmodium.
Okay.
So, you have different species under the family. You have Plasmodium vivax, Plasmodium ovale, Malaria, Knowlesi. But I think the one that is more relevant for us today is the one that is most common within the region that we live, and that is the Plasmodium falciparum, rather. So this infection, like I said, is parasitic, but it actually needs help. It's transmitted by a vector, which we all know as the mosquito.
Okay.
In fact, to be very specific, an infected female Anopheles mosquito, because the males don't feed on blood; they feed on nectar from flowers.
So
that's
the
what
men, they don't give troubles.
No, they don't give wala. It's the females that give the problem. Yes.
Okay.
Yes.
All right. So before we go into the meat, we like to know what are the signs and symptoms of this malaria? Because I believe our listening audience would like to know what the signs and symptoms are. Because most people take any slightest illness is attributed to malaria. Whatever they suffer from, the first diagnosis or the first thing they will give it to name they will give it to is malaria. We like to know what are the signs and symptoms of this malaria. So at least when they know, they can at least try and start seeking for help on time. So what are the signs and symptoms of malaria?
I strongly believe that our audience are very well versed with some of those symptoms.
Okay.
Actually, we need to look at it from the aspect of what kind of malaria infection the person is having.
Okay.
Is it a complicated or an uncomplicated? Or is it like simple or severe? So if it's an uncomplicated malaria, it just simply means malarial infection that has not affected any of the organs severely, like by way of damaging it.
Okay.
Okay, so that doesn't involve end organ damage. So you have your basic constitutional symptoms like fever, which is usually the number one at the top of the chain, and then you can have other symptoms like loss of appetite, weakness, nausea and vomiting, headaches. Okay, so but when you now start looking at severe malaria, there are some extra features that when you see any of these features, you become worried and the person will need special care. Most times the person will need to be hospitalized. So you look at the person is passing very dark urine, okay, because there's heavy breakdown of the red blood cells. Person can go into a coma or can even be having some seizures sometimes because it may affect the brain. The person would also have very low sugar levels, abnormally low sugar levels. Person will have very severe anemia, which is like very low blood levels. Okay, so when you see all these features, if they do a microscopy on the person's blood sample, they see a very high level of parasites. So when you see any of these features, then the person is like in the realm of malaria that is very severe.
Okay.
So, but at least with the basic ones, most people can. But of course, because there are other diseases
Okay.
and illnesses that can mimic these same symptoms,
Okay.
that's why it's important to actually test, and confirm.
Testing is very important because a lot of people abuse malaria medications.
Of
A
course.
lot of people, a lot. People hardly. I don't know how many of us do go for malaria test before taking malaria medication.
And
Once they have the symptoms, they just rush to.
Dr. Best Life,
Mm,
we also have some vulnerable groups like children under 5,
okay.
and then pregnant women in particular. So you know that with pregnant women, their symptoms, they also have some other things,
Okay.
which of course will be like, let's say, side effects on the child that they are carrying.
Mm,
So sometimes malaria in pregnancy, which is also a unique entity, can cause miscarriage.
okay.
And even if they're able to deliver that child, can cause stillbirths.
Yeah.
Sometimes it can also cause premature deliveries. It can lead to that, and even sometimes you can have low birth weight babies.
Yes.
So those are unique, well, I say, symptoms for pregnancy.
Oh, so you have heard from the expert. It's very, very important before you start consuming that malaria medication. Please and please get what tested. We even have
If
some
possible.
rapid malaria, texts.
Yes,
I'm not
yes.
saying that that should be the norm, but at least you can use those ones to test before consuming that malaria medications. And better still, go and see your what? Your doctor, your physician for proper diagnosis and treatment. Like you rightly say, most symptoms also mimic malaria symptoms. So thank you so much, Dr. Moran, for that.